everyone, I am Dr. Ravina, NHS Women's Health Doctor, and I'd like to welcome you to this channel dedicated for women's health. Today we'll be discussing contraception for women over the age of 40. So as you get older, your lifestyle changes. You may not want to take a pill every day. You may not want to have an implant in your arm. And what we really do need to consider as you get older is the risk that contraceptions have on your life currently in the short term, but then also in the long term, thinking about menopause and the risks post-menopause. So at age 40, we like to optimize your health, optimize the contraception that we give you. In this country, in the UK, menopause is usually at the average age of 51, but many women may experience menopause before or after this age. Alongside that, some women may experience symptoms 10 years before they actually become fully menopausal. So if their periods completely stop at age 51, they may actually experience some symptoms at the age of 40. For this, we can give hormone replacement therapy, but the combined pill and various different types of contraception can also help with some of the symptoms that you may get around the perimenopausal time. We will have a video specifically on menopause and the treatments for it. This video will just be for contraception. So let's begin. So the first option, which I think is a great option, many of my patients really like using this, and that's the MIRENA coil. So the MIRENA coil is a very small coil. It's probably like half the size of your finger, so perhaps just about that size, sometimes even smaller, that you insert into the neck of the womb, and not only does it stop pregnancy, but it also reduces your risk of endometrial cancer. And you can also use it as a progesterone component of hormone replacement therapy. So that will be the progesterone component that only acts locally in the womb and does not have systemic absorption into your bloodstream. The MIRENA coil can be used for 5 years and then you can change it, and it can be used actually up until the age of 50. In some cases, it can also be used up to the age of 55. So if you've got to the stage where you just don't want the periods, you've had enough of them, you don't need to get pregnant, you've completed your family, then you can consider the MIRENA coil. And as I've said, so many of my patients love it and they have continued to be on it for many years because they've used it as contraception and then they've used it as the progesterone component of their HRT. So option 1 is the MIRENA hormonal coil. Option 2 is the implant. So the implant you insert in your arm, it's usually on the inside of your upper arm, and this only contains progesterone. The difference between the MIRENA and the implant is MIRENA acts locally, the implant acts systemically, so it will go into your bloodstream and affect all of your organs. However, because it is just progesterone, it has a lower risk and there's a decreased risk of clots, like clots in your legs, your lungs and your head. So it's a little bit more safe. And the next option that we can consider is the oral contraceptive pill. Now, the type of pill that we can give has to be very specific, because when you hit age 40, we need to reduce your estrogen component to less than 30 micrograms of estrogen, and that's because we need to reduce your risk of VTE, so venous thrombotic embolism, which is a medical way to say clots in the legs, clots in the lungs and clots in the head. So by reducing the estrogen, we reduce that risk whilst also giving the contraceptive benefit, the birth control benefit, and can help with some perimenopausal symptoms. However, we can't really use the oral contraceptive pill as a HRT substitute. It's not HRT, it doesn't replace the hormone to a sufficient amount, but it is enough for contraception. So in terms of the pill that you can continue on after the age of 40, it would be less than 30 micrograms of E2, of estrogen, and that's the first line estrogen that we can give. Anything more than 30 would obviously put you at higher risk. And the type of progesterone that we can give is LEVONORGESTREL or norethistérone. So they're the two types of progesterone that carry the lower risk of clots. So the good things about the oral contraceptive pill is that there's a lower risk of ovarian cancer and endometrial cancer. And the reason for this is because you aren't having periods, so your ovaries aren't going through this cycle of releasing an egg, and your womb isn't being stripped of the lining through menstruation. But that's because you're not having periods. So that means you have a reduced risk of this cell turnover in the ovaries, in the womb, that can lead to cancer. So the good thing about taking the pill is that you have a lower risk of ovarian and endometrial cancer. And the reason for this is because you're not having periods, so you're not ovulating and you're not shedding the lining of your womb every month, which means you have less cell turnover in the ovary and in the womb, and there's less chance of the cells proliferating into cancer. That's why you have a lower risk taking the oral contraceptive pill. The bad things about it, however, are that you have an increased risk of breast cancer. So after 10 years of use, so if you stop using the pill, then this risk will then go back to the same as someone who hasn't used the pill, but only 10 years after stopping using the pill. Now, when you get to the age of 50, we have to stop the combined oral contraceptive pill. And this is because the risk completely outweighs the benefit of taking it. And we know the risk of clots is higher, the risk of breast cancer is higher. And if you've watched my previous videos on contraception, you will know that we use a criteria called the UK MEC criteria. And so after the age of 50, the UK MEC is 4, which is the worst possible tier in the criteria because the risk is too high. After the age of 50, you can use the progesterone only pill. And the reason you can use this is because there's a reduced risk of clot. However, with the progesterone only pill, we can only really give it on a case-by-case basis. So your doctor, your healthcare professional will have to take into account all your risk factors, whether you smoke, your family history, and only then will they decide whether you should be on the progesterone only pill. But most commonly, they might say perhaps go on the MIRENA COIL, or if you've had a year of no periods, then you don't need any contraception at all. So to conclude, this video on contraceptions for over 40s, we've discussed the MIRENA COIL, the implant and the oral contraceptive pill, specifically at a lower estrogen dose and using specific progesterones of norethistérone and levonorgestrel. So I hope you found this video useful. If you have specific questions on your type of contraception, or you have any worries, or perhaps you have good experience of using particular types of contraception, then please share with us, place in the comments below. And if you have any questions, feel free to direct message me on Instagram at dr.ravina. Thank you so much. I hope you've enjoyed this video. Please like, subscribe and share if you have enjoyed this, and we will see you next time. Take care. Bye.